Your voice matters. That's why we want you to tell us which innovations you feel could make the most impact. Thank you for joining us for our series, The Bitch is Back, focusing on cancer recurrence. Take a look at this brief recap of our 4 innovators and then rank them to help us better gauge your support for which innovations Cancer Fund should invest in. Here are our innovators.
So, what we're really addressing is the fundamental problem with our current approach to cancer treatment, which ultimately leads to aggressive recurrence due to therapeutic resistance. So most modern and the best available cancer therapies that we have target what we call a single hallmark of cancer, or a single biological process that drives cancer progression and growth. And the issue with that is cancer cells are very smart, they're highly adaptable, and so they readily hijack other biological processes to ensure their survival. And so really what we're trying to do, the real problem is how we approach cancer, and we're taking a different approach.
I describe it like this, so maybe this is just a bit of a step back and might be too simplistic, but it's like I'm normally in a room and there's normally a big chandelier or a big light overhead, and I point to the light and I say, that's the cancer. And I say, we want to turn off that cancer. So you turn off the switch that is driving that light or that cancer. And I point to the switch on the wall and I say, that's PI3K switch stuck in the on position in the cells, giving signals for the light. So what normally would happen, you'll cut the wire, say, to that switch, and the light will go off, the cancer will go away, and you'll think, yes, we've solved it. But then all of a sudden, a few minutes later, it'll start flickering, and the light comes back on, the cancer's back, and you listen carefully, and you hear this murmur in the background, and that's the emergency generator kicking in, and that is the PIM kinase. So that's how I describe it.
So we're trying to develop a universal cancer drug enhancer, which is a very tall order, but we think we have the data to show that it works. Drug resistance is the cause of over 90% of cancer deaths, and it's one of the biggest problems, right? You give a drug to a patient, it may work at first, but then it stops working, or the drug may not work at all. So what we've noticed in our research is that although there's obviously cancer is very different, and the drugs that treat cancer are very different, what we found was that cancers actually use very common mechanisms of resistance. They rewire their signaling pathways in very similar ways to resist a number of therapies. So what we think is, if we can have one drug that's able to stop this rewiring, then we can have some sort of cancer drug that you can basically add on to any existing therapy to overcome resistance to it. And that's what we hope to do.
Well, the main problem we're focused on is this problem of therapy resistance. So a cancer survivor will go to see her oncologist and she'll hear these words, your cancer's back. And it's the most devastating thing that a cancer survivor can hear. This is really the problem that we want to address, is that cancer just has this way of changing itself, after it's been confronted with an effective treatment, be that a surgery or a therapeutic agent. Cancer just changes.